arthritis is a condition where the cartilage inside the hip joint has been worn out and damaged. And when that happens, you may have pain and stiffness in your hips. How that affects you is that you may have problems with your activities of daily living, like walking, climbing upstairs, going downstairs, or even reaching over and tying your shoelaces. You may find that apart from the pain, your joint also becomes more and more stiff. So you have problems twisting your foot inwards and outwards. And again, that may translate into you having difficulties in your activities of daily living. Hip arthritis is caused by a variety of conditions. The most common condition that causes arthritis in Singapore is actually this thing called hip dysplasia, where after birth, the hip doesn't form quite right and there's a misshapen hip joint. The result of that is that over years, the contact stresses in the joint becomes abnormal and there's advanced degeneration of the cartilage in the hips and in the hip joint, leading to arthritis. The other conditions that can also cause hip arthritis include just natural wear and tear as a result of movement over the years, and we know that certain populations are at risk of increased hip arthritis, and this will include people who are overweight and especially women as well, because women tend to have thinner cartilage after menopause, so that can cause an increased risk of osteoarthritis. Other conditions that can cause hip arthritis include avascular necrosis, which is common in people who have taken steroids, people who have taken tainted traditional medicines, people who abuse alcohol, or even, interestingly, among deep sea divers, where the pressures during diving can cause abnormal blood flow to the femoral head and cause avascular necrosis. So the treatment of this condition really depends on what are the symptoms that the patients are experiencing. If the patient only has mild symptoms, not affecting their function too much, we can start with simple solutions like weight loss, physiotherapy, as well as the use of assistive devices such as a walking stick. And the purpose of all these things is to offload the pressures and the stresses on the hip joint so that the patient doesn't feel as much pain. When these treatment therapies no longer help the patient, then we can move on to other things like hip injections or surgery. Surgery is usually reserved for patients whose arthritis is severe enough to cause them difficulties with their activities of daily living, like walking, going to the coffee shop, going to a job, or even shopping. As long as the pain affects your daily function, then it is time to consider a hip replacement surgery. A hip replacement surgery involves removal of part of the joint that is causing you pain, so namely the femoral head, as well as some of the cartilage inside the hip joint, and replacing it with an artificial hip joint known as a prosthesis. These prostheses are made of a variety of materials, including metals, ceramics, and plastic, and the exact combination will depend on your activity level as well as your age. The hip replacement surgery, after it's done, will allow you to walk and climb stairs without pain, so that you can continue with your activities of daily living without the pain that has been nagging you for the past few years.